There's a ton of interest in PDO threads, both positive and negative, because it's a little more aggressive than most treatments we're used to. It seems almost barbaric to some people. I know I've posted a video of me doing the procedure to my mom, and that's on my feed somewhere. I can post that again. But PDO or polydioxanone, it's an absorbable suture material. We use them in internal sutures and orthopedics and all kinds of other surgeries. They dissolve on their own. While they dissolve, they stimulate collagen. Great supporter of the skin, which we love. There are lifting threads and smooth threads. The lifting one, thick, they come in different lengths. They are, you can't see it on the screen, there's laser cut barbs on them. There's different types of barbs. The molded Max have thicker barbs. The molded Levos have thinner barbs. There's 19 gauge, 18 gauge, 20, 21 gauge. We use the type of gauge that we think based on how thick the skin is, how heavy the skin is. So what we do for the procedure first is we numb the areas where we're going to inject with lidocaine. And people ask a lot, do the threads hurt? The only part that's uncomfortable, or the most uncomfortable part, is the numbing process. Why? Because lidocaine has a lower pH than our tissue, so it's more acidic. So if I'm putting some in to lift the fat pads of the cheek and the skin, I inject back near the hairline lidocaine. If I'm doing the jowls, I inject here. If I do the neck, I inject here. It kind of depends on wherever I'm injecting. And then I use a blunt, meaning non-sharp, blunt tip cannula, and I get into the pilot hole and I come down to where I'm going to put the threads in. As I'm pulling the blunt cannula out, I inject lidocaine, and that's when you feel that burning. When the cannula is sliding through, it's not sharp, it's not bruising you, damaging any vessels. It slides between the fat pad and the skin, and that's what you feel. You go numb, right? And you feel like you're at the dentist. Then after you're numb, then I put the threads in. FDA approved, pre-threaded. So they come, I took this one apart so I could show people. They come and typically, the thread will be inside here. So I come through the pilot hole, I put them where I want, and then I hold here, pull back, and as I'm pulling out, the thread stays in the skin, and you'll have the end hanging out a little bit, look like a little bit of a marionette. And then once the threads are in, I literally take a forceps and I pull back, and you lift the fat pad, lift the skin, and then you see that immediate lifting effect. I then, when I have everything where I want it, I'll do both sides, cut the threads, and they stay in. You don't see the end, and they stay in your skin. They dissolve over 6 to 9 months, and as they do so, around where they sit, they stimulate collagen, which thickens the skin and helps maintain results for up to 2 years. Depending on your age, how much skin laxity you have, how much extra skin, how heavy it is, that will determine how long the results last for you. If you're in your 30s, you're gonna get longer lasting results than someone in their 70s. What are some potential complications of threads? The most common is initial puckering of the skin, and that happens because I want to pull you as tight as possible initially, knowing that over the first 1 to 2 weeks you're going to lose some of that pull. So that settles over the first week, maybe 2. If it stays, I can loosen it a little bit. Easy in office, simple procedure. They can break if you're being too aggressive. If the skin is too heavy for no reason at all, they can break. I can take them out. Asymmetry, again, we can fix that in office. You can take these threads out. That's the thing people need to understand. Something happens, you hate the results, one side's uneven, you can take these threads out. They can bunch up. You can fix that in office as well. The more serious complications would be nerve damage, right? So if you're going too deep, if you're going under the muscle, you could damage a nerve. If you're where you should be, which is between the fat pad and the skin, then you're not going to damage a nerve. The other potential serious complication would be infection. We make sure to cleanse the skin very thoroughly with alcohol and ChloraPrep. Then you use clean procedure. As long as you're not picking at the insertion sites, you're immunocompetent, meaning you don't have immune issues, most likely you're not going to get an infection. We are fully available all of the time. If you have any concerns, we follow up with you very closely.